A lot of people are asking us about cosmetic surgeries. What is the most popular cosmetic surgeries? What are some complications? Do you recommend it? Not recommend it? I get patients that ask that all the time.
Yeah.
So,
well, I think the best part is maybe like named like the top 10. Right?
Top 10.
Top 10, and we could go from there. And for us at least, the biggest issue is the complications.
Oh, dude, complications. Welcome back, AJ.
What's up, man?
It honestly feels weird that we don't have a guest.
You know, we've been having a lot of guests lately.
Boys
honestly.
episodes are always the best,
Yeah,
huh?
it's awesome. But right now, kind of back to where we were initially.
Like how we started?
Yeah, I liked it. I like it.
It's been a nice journey, honestly. Podcasting is fun.
It is.
I recommend that to everybody. The only problem is everybody's doing it nowadays.
Yeah,
and I feel like it's getting like cluttered. The internet is like filled with a whole bunch of podcasts and.
Well, what we got like over 60 episodes, full episodes. We've got over 500 videos on Instagram and everything else. But I realize there are a lot of people who are trying.
Yeah.
A lot of them are really they should not be podcasting.
Yeah.
I'm not gonna lie to you. And there's a lot of people that got tons of potential too. So
the other thing is that I don't think people realize how hard it is to take the audio, to take the cameras, take it, upload them, edit them.
It is a process.
The thumbnail, all of that. That's a whole process. Thank God we got Thomas to help us with it too.
It is a process. Thank God. I mean, I think that's what it is. It's a DocTok team, right?
Yeah, we have a great.
We have a pretty awesome team. And last week's episode, Nikki did fantastic too. So,
I love Nikki. She's amazing.
Yeah, she did great. So we were pretty happy.
She's good at what she does too.
She's fantastic at what she does. See, this is the best thing to me about podcasting is that we get to learn so much from all these amazing people. Because for us, it's we're doctors. We see so many problems and issues from all these different types of patients. But to learn something new every day is the best thing.
It's amazing. And as doctors, we learn every day too. It's not like we're not learning. We're reading every day. There's new case studies that come out all the time, and you kind of got to stay up to date with everything.
I agree.
When it comes to today's topic, a lot of people are asking us about cosmetic surgeries. What is the most popular cosmetic surgeries? What are some complications? Do you recommend it? Not recommend it? I get patients that ask that all the time.
Yeah.
So,
well, I think the best part is maybe like named like the top 10. Right?
Top 10.
Top 10, and we could go from there. And for us at least, the biggest issue is the complications.
Complications.
And they're so.
Well, we don't do the surgery, so kind of when our patients ask us about the surgery, we just talk to them about the complications.
Yeah.
Now there are benefits to a lot of these cosmetics. So like. Most doctors are always saying no to everything. There are situations where you do need to do it.
Yeah, I agree. And the first one that we talked about actually earlier was breast augmentation, right? And it's popular.
So that's number one. Most popular.
It's rated. Like a lot of the guidelines show like the
Can you
most
explain
popular
what that means? Breast augmentation. So
it's basically you just want to enlarge your breasts. Yeah. Simple as that.
What size do you prefer?
That's a very good question. I mean, you know what? A C.
Yeah.
C, or maybe a D cup, D cup.
D is a little bit too big, I think.
It depends. It's an acquired. It's different. A taste. It's your taste. You know. Are you more of a C guy?
The problem is that I see a lot of women that have big breasts, especially when they lose weight. They struggle with back pain and a whole bunch of issues.
I agree.
I got to tell you a story about that. So I had a lady that had breast implants placed, and for a long period of time, she felt like she had pain, and she kept saying pain, pain. She showed up to the emergency room. She's like, I don't know, something itches. So we did an exam. We brought, one of the nurses in. We did an exam, and her breast had a full infection. It was necrotic, all black,
full necrotic,
leaking, and the implant itself was already out of the breast, completely out.
Horrible.
And I don't know if she was telling the truth or not, but she had no idea what was going on.
Like,
can you imagine
did
how
she wake
long?
up with pain, or
Yeah,
what
she just
happened? What triggered it?
She's just been having breast pain for a long period of time. She came in, she had a horrible infection and had no idea. She didn't keep up with it. She didn't go to the doctor. It was black, necrotic, green, discharging, and
God,
it was literally popping out. And so, like, there are a lot of bad things that can happen with breast implants. I mean, if you were not, if you were born with, like, it's it's an imperfection in your mind and you're insecure about it and you feel like it would change your life, do it, you know?
Absolutely.
But there are complications to that.
No, I agree.
And people are always talking about going to different countries. There's risk to going to different countries.
Well, because it's cheaper, right? And that's
Yeah.
what it is. But see, I don't really recommend that.
Yeah.
I don't really recommend that. Even if you have to pay a little bit more, it's not worth your life, right?
Yeah.
But the complications, I mean, like you said, that was a major complication, right?
Yeah.
Infection, rupture. Another very popular one is that sensation to the nipple. They lose a lot of sensation to the nipple too.
That's important too.
Yeah, exactly. So that's something that you have to consider. But you speak to a lot of plastic surgeons. It's common, but it's a low risk. You know, tons of people get it done. They're fine. Everything looks good, and they're happy with their breast augmentation. So it just really depends on the patient and post-op and recovery, because it's very important to kind of maintain like massages. A lot of like infections, seroma, scar tissue tends to
Still
develop.
a surgery. At the end of the day, surgery is surgery. So people need to understand it's still a surgery.
Absolutely.
And anesthesia risk and a whole bunch of other things.
Yeah, so before you consider it, I definitely think you should see your doctor. Make sure you
And
check.
educate yourself, right?
For
Look
sure.
up everything.
Yeah, and talk to people. Talk to
Jinx.
double jinx, triple jinx.
Dang. Okay. All right, so that's number one, most common. Number two, liposuction.
Yep.
Right. Liposuction, I get that asked a lot, you know, and people are insecure about their love handles, or if they have enlarged breast as men and they want to get rid of that extra fat.
Yep.
What do you feel about liposuction?
Well, first of all, if you're not going to change your lifestyle, you get liposuction, you lose what, 10 pounds, 15 pounds, whatever, it's going to come back.
Yeah, you got to, before doing the lipo, you definitely have to change your lifestyle.
Yeah, you have to, because if you start eating the way you normally eat, you gain the weight, it's going to come back. But a very common complication of liposuction are like seromas. And what is a seroma? It's basically like this fluid collection between the fat and the muscle, right?
Painful too.
So if you see a lot of people like after liposuction, they do a lot of massages, or if there's a drain that needs to be left or whatnot. So that's why you do a lot of these massages too, because that's a very common complication to develop that seroma. And even though it's not as dangerous, but it can become complicated. So a lot of massages, make sure if you need the drain, you need the drain afterwards, and just make sure you still follow up with your plastic surgeon.
That's number two most popular.
It's pretty popular.
Yeah.
And everybody wants to lose quick
A lot
fat.
of people I asked thought Botox would be number one, and it wasn't even. I don't even think it was in the top five.
Yeah. Well, it's probably maybe in the like the top, maybe
top.
Like
it's in the top 10, but it's not in the top
for
5.
sure. But it's not the top 5. But yeah, so liposuction is pretty popular, man, and a lot of these plastic surgeons do, and they make tons of money off of it.
Jay, what do you think of my nose? It's pretty big, right?
I think you need a rhinoplasty.
That's number 3, guys. Rhinoplasty.
Yeah.
That's very popular in Turkey. Right? By the way, I visited Turkey and at the airport on the way back. It was a whole bunch of women wearing masks that all got rhinoplasties, and a whole bunch of men that got hair transplant. Like, you can look up. It's literally all men with bleeding in the back of their head. They got the full transplant, and women that all got all their nose done. Listen, there is a lot of complications to that too. But I will say, if you are somebody that was born with insecurity, you have a huge nose. A lot of Middle Eastern people have big noses.
Middle Easterns.
And you can't change. Like, here's the thing, right? With lipo, you can try to lose weight, cut out your fat and diet. You cannot. Well, how are you going to lose your nose?
You can't. You're screwed. Especially like a lot of bigger people who lose weight, all of a sudden
and then their nose is so much bigger.
Yeah.
And I do feel bad for them. So, like, a lot of people do get it done, and they're very happy. A lot of I know people that have done it, and they love it. So they do not regret it.
Yeah, but see, again, the risk is always, okay, complications, are lower risk, but what are the complications? You know what's a big one is trouble breathing. Yeah. You know, a lot of people complain of trouble breathing or frequent breathing issues, or sometimes the nose is a little bit crooked, right? It's just not, the symmetry of it is just like not straight. So these are complications.
And gotta make sure you don't have obstructive sleep apnea and have all these other risk factors with it.
For sure.
So check in first. And if you are going to go to a foreign country, please do your homework.
For the love of God,
please do your homework first.
Yep.
What do we got? What's number 4, AJ?
Number 4 is blepharoplasty, which is basically just eyelid surgery. And a lot of our patients have it.
A lot of older
patients have it.
They can't see. Some of my patients, their eyelids are literally over their eye and they can't see.
Yep.
So, but it's so hard to get insurance to approve it. It is hard to get it.
If it's affecting the quality of your life, get it done.
Yeah,
for real. And you know, the older you get, the harder it is. And then sometimes you wait too long where you can't have the surgery because it just becomes too risky. But again, same thing, bleeding, right? Bruising, that's a big deal also. A lot of bleeding, a lot of bruising, infections and stuff. I guess anywhere you cut you can get an infection.
Yeah,
So
infection
you gotta be
is
very
like
careful.
I mean, everyone's going to say infection. Well, obviously, everything is at risk. Anytime you cut, you're at risk for infection.
Yeah, blurred vision, double vision, right?
Yeah.
That's another one too. So a lot of them complain of that, and sometimes you just have to, maybe talk to your doctor and make sure that you know what to expect afterwards and what things that can happen.
If it's cosmetic, I don't recommend it. If it's something that's like affecting your vision, you can't see,
For sure.
just get it done.
For sure. And number 5,
5.
abdominoplasty.
Yeah.
Tummy tucks. So basically, it's just basically removing a large portion of the abdomen, like skin. They put a new belly button for you. But see, this causes a lot of complications like the seromas, hematomas, bleeding, infection. I mean, I've seen tons of this. But again, very important to get that therapy. A lot of massages afterwards. Why do you think they wear? They call it the faja.
Yeah,
Right,
faja.
the faja. Why do they wear the faja to push out all that fluid?
What the faja is?
A faja is basically.
I mean, like all my.
It's
I'm
a
not gonna say
very,
that
very
word. A lot
tight-
of overweight people wore it.
Yeah. A lot of people still wear it as for just like when they go out, so they don't look fat. It's a tight shirt.
Honestly,
that
I
you
would wear it now. I need it.
Yeah, no, but it's good for somebody who's got a little bit of belly fat and you want to cover it up and you want to look nice in a nice suit or shirt. You can get a fajas. Don't spend $20 on fajas. They're horrible. Spend some money on it, like $100, $120, because they have some really, really good ones. So they wear the fajas because you want that tight pressure in order to push out all that fluid, especially if you got the drain.
Yeah.
Right. So that so you don't develop seromas or develop a lot of hematomas. And then we go back. What are seromas? Remember, you get all this fluid development between the fat and the muscle. It's pretty painful, but you wear the tightness so you can squeeze out all that fluid.
By the way, my first surgery I've ever done in my entire life was a tummy tuck.
Really?
Yeah, I was a
Oh,
student.
when you were in a surgery rotation?
Yeah, I was a student. No, I wasn't even in that.
Oh, you were a student.
So they said, hey, who wants to volunteer? I think I told this story before, but I think it's a good time for it. They said, hey, who wants to volunteer? I said, let me volunteer. It's my first time. I was so nervous. I put the mask on backwards. So you know the part that clips the nose? I didn't clip it, and I put the opening like this. So the surgeon's doing a tummy tuck, and he's lasering off the fat, and my job is to take the suction and suction out the smoke. Well, the smoke kept going up my nose because I didn't have it clipped, and I kept getting dizzy, and I'm like, I'm about to pass out, and I actually passed out. That was my first time I ever. I passed out during that surgery. But that was the only time I ever passed out.
You were a student. It's okay. You were nervous. You were like, oh,
I
God,
know.
I don't know what to do.
Now here goes all the med students and the residents and the doctors ripping on me.
Yep.
Go ahead, guys.
Yep.
Anyways.
So that's number 5.
What's
Number 6 is facelift.
Is this really necessary? Let me tell you something. I saw a lady in Turkey. She was like 70 years old. She did a facelift. I swear she looked 40 afterwards.
Bro,
But
a
it's
lot
not
of people
safe.
do it these days. I mean,
It's
you go to
not safe.
Miami, everybody's doing it in Miami, honestly. And everybody wants to look younger. So, listen, again, it comes down to you being healthy, following up with the surgeon afterwards. But a major complication is a lot of facial nerve damage.
Yeah.
And that's something that I'd be more concerned to do it, honestly.
Yeah.
Like nerve damage in general. And then again, infections, hematoma, bleeding, bruising, etc.
When is natural beauty going to come back again? Like, I
don't
feel,
think
I
it
keep sinking
exists.
in. And that's why I'm like, by the end of the thing, I'm
Yeah,
like,
you're gonna be-
sorry, I keep sinking in. Anyways, when is natural beauty going to come back to being popular? Because I'm kind of getting tired of, everybody looks fake, man.
Do you wanna
And they all
know
look
why?
the same, especially if you go to the same surgeon.
If you look at the 1900s compared to where we are right now in the 2000s, people ate differently.
Yeah.
People exercised differently. They were more active, eating healthier, more organic. So your skin looked better.
Yeah.
You looked younger. But now people are more stressed. People are running multiple jobs, right? So your skin is going to wrinkle.
Yeah.
Skin is gonna wrinkle. And everybody wants to look amazing. Why? Because image is important these days.
Yeah.
Everybody wants to look younger.
I feel like every man says that they want natural, but then the second a girl passes by with plastic surgery, everybody's looking. And
Have you ever seen like on social media or like on YouTube a lot of these complications post-op?
it's
with
my god! Did you see the girl on TikTok?
bro, it's insane.
She showed her post-op. She was bleeding in her abdomen.
It's
Wait, did I say
terrifying.
Botox? I mean her BBL.
Yeah.
She had a BBL done. She had bleeding all in her abdomen. It was she was screaming in
Bro,
pain.
no, but I'm talking about your face. You don't recognize them anymore.
Yeah.
Their lips, their eyes, they're swollen. Yeah, bro. Honestly, it's a disaster.
Imagine
it's
like this
a
all day.
disaster. No, and the scary part is that
Yeah.
they were so beautiful beforehand. They looked beautiful, and all of a sudden their lips are huge, and their eyes and their jaw is just nasty.
Yeah.
Nasty. It's
And
not
if it's
worth it.
unnecessary, you don't need to do it. You
Yeah.
look beautiful how you are.
Yeah. Thanks, Thomas. You do look beautiful, Thomas.
Thanks, Thomas. You're the best.
You are.
And guess what? Number 7. It made the top 10, but not the top 5. Botox.
Huge, bro.
Listen,
Huge.
I will say, let me start off with this. Botox. For people that have a lot of wrinkles on their forehead, I do recommend it, to be honest with you.
For sure.
And for people that have RBF.
Yeah. Resting bitch face.
For people that have resting bitch face.
We know a lot of them.
Yes. For people that have resting bitch face, I will say Botox helps because I had a friend that just always looked angry all the time. Like this, and she got Botox,
and she looked like a different person.
She looked happy all the time.
Well, it's the best.
So for those people that have RBF, maybe it's beneficial for you. I do recommend it.
Yeah. Well, see, that's with Botox. Remember, again, the complications are the asymmetry, right?
Yeah.
Or
You're basically tightening the skin, right?
Muscle weakness.
Yeah.
You get temporary muscle weakness, and sometimes some nerve damage. It really depends. Bruising. It really depends who does it. That's why you got to make sure the person that's doing it knows what they're doing.
But also, there's benefits to it for people that grind their teeth. TMJ. They can do it for TMJ, for migraines. So there's a lot of benefits to Botox.
There is.
But just don't overdo it because you can see all these older ladies that have done it for a long period of time. Their skin sags.
Oh,
if it's not necessary, don't do it. If you got a lot of wrinkles on your forehead like Thomas, just get it done. Thomas, well, don't worry. We got you.
Yeah, we got you. We'll hook you up with some Botox.
Actually, you don't even have that many.
No, he's still young.
He's not bad. He's actually done it, probably. Yeah. You've done it, bro.
No, you know why? Because he lost the weight. He looks good,
yeah.
bro. His skin is better. He looks good.
Yeah.
He looks good.
Also, like with weight loss, we were talking about this. Like half a pound to a pound a week is good. Don't overdo it because then that's when you're going to have the extra skin.
Yeah,
You're going to need a tummy tuck.
Yeah, for sure.
And then you're going to end up on this list.
Yep.
What do we got? Number 8.
Breast reduction. Needed for a lot of people, honestly. I mean, people with very natural big breasts and lower back pain, complications, the way they walk, it's hard.
I actually recommend that to a lot of people.
Yeah, me too.
I had a friend in med school. She walked like leaning forward. She had the biggest breast ever, and she would always like lean over with her neck. She always had back pain, and she got it done, and she was able to like do certain sports and run, and she was just way more active. Just imagine having big breasts all the time, that extra weight carrying around.
Horrible.
So breast reduction when it's needed, I do think it's important, but it's hard to get the insurance to approve it, man.
I agree. It's got to be, you've got to have, legitimate reasoning and complications like
100%.
lower back pain and stuff like that for them to do it, honestly.
100%.
What about number 9?
Number 9, for all men, hair transplant, aka turkey.
Bald
hair
is
transplant.
sexy.
Listen, I will say hair transplant has advanced tremendously over the last 10 years. I mean, insane.
Yep.
They went from taking a piece of hair from the back, putting it in the front, and growing it. Then they did the FUE. Then they did the DHI, and we did a whole episode. Make sure you guys check out the episode on the hair transplant.
Absolutely.
Well, the most recent advancement they're doing is the DHI, which is the direct hair implant, where they have a new piece where they take the hair follicle and then they inject it direct, and it's working. It's working great. But it depends on your age, right? So a lot of older people, they don't qualify for DHI. They qualify for FUE.
Yeah.
And I get a lot of questions on minoxidil and finasteride. I do recommend for people to start using at least the spray, like the Him spray or whatever,
like initially,
initially.
yeah.
And afterwards, every single surgeon will recommend oral finasteride, but there's risk factors of sexual dysfunction. Question to all the men watching this episode: do you prefer to have a full set of hair but a flaccid penis, or bald with a full hard rock on like AJ? That's AJ's favorite line. Always. I like your haircut.
Need a haircut?
And then he takes off his hat. Need a haircut?
Need a haircut?
Awesome. Hair transplant is very common. A lot of people, where they do it really, really well? In Korea. South Korea. South Korea is excellent for hair transplants.
Really?
One of the best countries in the world, actually. The problem is in the U.S. it's so expensive. $5 a follicle. If you're doing 3,000 follicles,
this is going to cost
$15,000. Whereas in Turkey, it would cost you about $2,500.
Fuck that, bro.
So that's why people go to Turkey, but there are complications to it.
No, that's why you shave your head.
Shave your head and look like AJ.
Yeah.
Okay, AJ, number 10.
Drum roll.
Literally.
It's ear surgery, bro.
Yeah.
That's actually.
What do you mean by ear surgery?
Autoplasty.
Yeah.
Bro, you know how many people have like disfigured ears? Like
Anwar?
Yeah, like bro, their ears.
Anwar, you need this, bro.
And a lot of them do. But see, it's a lot of cartilage, a lot of infection, a lot of bleeding. I would only recommend it if it's completely like malformed.
What if it's like our uncle that had ears that we could fly? Like, what did we call him when he was younger? Younger?
What, Dumbo?
Did I say younger?
Dumbo?
Leave me alone. Younger. Dumbo,
Dunger,
yeah.
Dunger, did you call him Dunger?
Dunger.
Did you say Dunger? Bro, he's losing his mind.
I'm losing it. Okay, yes,
Yeah.
but what do you recommend? Do you recommend that or?
I recommend it if it's affecting the quality of your life.
Yeah.
Honestly, if it's really ugly and it's and you just you're bothered by it. Yeah, absolutely.
For all of these surgeries, guys, like speak to your doctor first. Do some homework, and if you are going to go outside the country, again, make sure you're going to the right facility.
For sure.
Make sure they use the right equipment. Read some reviews. Educate yourself on it. This is a very important thing. It's life changing.
Yeah.
You know, like BBLs now. Everybody's getting BBLs.
Yeah.
I will say, and I think our audience will agree. BBLs are becoming less popular. And I do feel like Kim Kardashian sets the tone, right?
Yeah.
She got a big butt. Everyone wanted a big butt. She got a small butt. Now everyone wants a small butt. BBL is going out of style, and I think it's overdone. And you see all of these women with their butts, like they're uneven. It looks awkward. Their waist it just looks weird, guys. If you don't do it right, it's awkward. Don't do it. It's not worth it. And the complications are crazy.
Yeah, but you know what? I spoke with a surgeon about it, and
There's so many people that died.
He said. I feel like I don't want to say it's not a myth or kind of like a rumor. I just feel that, okay, he said it's very low risk, actually.
You think so?
But, yeah, it's low risk. A lot of complications are low risk. But if you end up having it, it's a huge problem. Does that make sense?
It can kill you.
Yeah, like
a
fat
clot
emboli.
will kill you.
Fat emboli is a
will
big problem.
kill you.
Yeah, exactly. And seromas are like a buy one, get one free. Everybody develops seromas.
They suffer.
So for any surgery you do, the best advice as a doctor that I'm going to give you is your post-op treatment and therapy is as important as the surgery, if not more. So make sure you go to your appointments, get your therapies done, follow up with your doctors constantly,
Take the medications appropriately, do the massages.
You develop an issue, you address it ASAP. Don't let it wait for a couple of days until it becomes a huge problem,
If you can't afford it, and you can't afford the therapies after, don't do it.
Don't do it. It's not worth it. You're going to end up, it's going to be horrible. It's going to be horrible.
Worth it.
So, yeah, man, but those are the top 10, man.
You look great. You don't need any of those.
Thank you, bro. Thank you so much. I'm not going to say that to you because you need some more.
But
man. Rock on, dude. Great episode today.
Thanks, man.
Awesome, man.
Peace out, guys.
We'll see you guys soon. Thanks. Bye.